Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hey guys, welcome to another stream. Thank you so much for joining me tonight. I'm so glad that you're here. Let us talk about a few viewers' questions I've been getting on the channel. And hi to guys from Facebook. I'm so sorry, people on LinkedIn. For some reason, I just couldn't connect it. So maybe I will share the stream as a separate video there later on. But yeah, we were supposed to be going live YouTube, Facebook, and LinkedIn, but something's just happened. Anyway, how are you guys doing today? This stream is going to be looking at questions around fibroid surgery. One of my viewers sent in a couple of comments and wanted to clarify some bits about fibroid surgery, so we look at that. And then somebody wanted to know about fallopian tube blockage, and the last question was about the Depo Shot. So I do have videos looking at these topics broadly, but of course when different questions come that maybe were not covered in the video, then it's quite useful, I think, to go into them. So yeah, I hope you guys are doing well. My name is Dr. Sylvia, as I think you heard in the intro bit just now, and I'm a general practitioner based in the United Kingdom. I provide health information videos because I'm interested in health education, helping people to be aware of their own bodies and how certain disease conditions develop, on how to prevent ill health. I do not provide medical advice on this channel. It's not possible to do that on a platform like this, and it's best with a registered doctor. That's the doctor you're registered with, who is licensed and who knows your medical background, to be able to provide you the appropriate medical advice. So I always put that disclaimer on before I start talking about the questions or whatever content that it is that we're discussing, because I think that's really useful. So hi to guys that are joining the stream live. Thank you so much for joining in. Please say hi in the chat. And if you've got a question related to the topic, then of course you're free to share it in the comment section or in the chat, and then I can have a look at it. I am going quite quickly today because I really need to get away within the next, maybe, I don't know, I need to get away pretty soon. But yeah, let's just get into it. Let's get into the very first question, which I think we'll be looking at fallopian tubes. So I'll put the question up on the screen so that you can read it along with me. Let me just take the ticker off here so that you can see properly. Okay, so that's the very first question that we're dealing with. This is what we're working with. Somebody says, do you feel pain when your fallopian tubes are blocked? So that's the question. Let me know what your thoughts are. I'll give it a few moments while I just get my images up. Let me know what you guys think about fallopian tube blockage. I think it's a really, of course, it's a really important question. And a lot of women experience this condition, and it's good to understand what is going on in the body. So let me take that off. And of course, you can see from this image that I have here, the fallopian tube, you can see the healthy uterus on the right-hand corner. So that's, you know, what you'd expect. The fallopian tubes are the extensions of the womb, and they come out on both sides, and they open up into or towards the ovaries. So the ovaries are the cream-colored or white-colored structures that you can see there. But sometimes something happens and then the fallopian tube gets blocked, and that's what you can see in the big picture. And of course, the most critical thing about that happening is that the egg, which is coming from the ovary, cannot get past, as it's supposed to be traveling down into the womb, and then sperm that are trying to get in to fertilize the egg cannot get through. So the impact, of course, is on fertility. So somebody says, do you feel pain when your fallopian tubes are blocked? I'll leave that image on so that you keep in mind what it is that we're talking about. But the answer to that straight off is that no, usually when there's a blocked fallopian tube, you wouldn't feel pain. It wouldn't cause pain. And I've said usually because I'm going to qualify that, but usually the condition fallopian tube blockage doesn't cause pain. So it is not something that is going to give you pain the way that, say, fibroids, for example, will give you pain. And in fact, many women who have a blocked fallopian tube do not even know that they have a blocked fallopian tube until they are trying to get pregnant, trying for a baby, and then there's a problem, then they have tests, and then the test says, oh, blocked fallopian tube. So many times it's without symptoms. And I think it's really important then to understand how do blocked fallopian tubes happen. I have a whole, I think I have 2 videos on the subject, so I'm not going to go through all the different ones, just a couple of common ones I'll just talk about now. So please go and check out the videos, and I will put it in the description box later, so if you want to watch and understand the topic in detail. But I think what's important is that the causes, or some of the causes, of a blocked fallopian tube themselves can be related or can be associated with pain in the tummy, in the pelvis. Okay, so let's look at some of them. So bear in mind, the fallopian tube itself, the blocked fallopian tube itself, as a condition that is present, you wouldn't really experience any pain. It's not going to cause pain, but what led it to happen likely can cause pain. So the first one is pelvic inflammatory disease, or PID, which you would understand or probably know as an infection that is coming up from the lower part of the your private organs. So talking about an infection that gets in through the vagina and the cervix, by the time it travels up towards the tubes and the ovaries, and we're calling that a pelvic inflammatory disease. Most often it's as a result of a sexually transmitted infection that's not been properly treated or not been promptly treated. So it's not been quickly treated, or it's not been well treated. And so if the infection, the PID, is allowed to continue, first it will make a woman very, very ill. It can lead to sepsis, can potentially be life-threatening. And if those 2 really bad outcomes do not develop, then you might be left with scars developing. Sorry about the noise. You might be left with scars developing within the pelvis, where the womb and the ovaries are, and that is how the tube itself can get blocked, because of scars and scar tissue and adhesions forming. So that's how PID could lead to a blocked fallopian tube. So this condition itself, because of the scarring and because of the inflammation that's happened, will cause pelvic pain. It will do that simply as a symptom of the condition PID. Over time, perhaps the infection will eventually settle down, but the scarring that it's caused will not go, it will still affect the fallopian tube. And after some time, you may not experience any pain because the tube is blocked, or any pain will necessarily be because of the PID if it's not being treated. So I hope I've made that clear. I'm trying to establish a distinction between somebody who has PID and who is having pain and fever, vomiting. Those are some of the symptoms that you might see there. The tube, of course, is being affected because it's a PID. But after all that has settled down, it's not going to stop the tube blockage. This tube blockage is something that will continue. Once the infection and inflammation have all settled and gone away, the tube blockage remains, and there may not be any pain at that point. So that's one, that's PID. The second one is something called endometriosis, which again, if you're familiar with my channel, we have a playlist on endometriosis. It's simply when tissue that normally belongs in the lining of the womb now starts to appear in other parts of the pelvis, commonly in the pelvis. In some cases, can travel far wide out of the pelvis into other parts of the body, but commonly within the pelvis. So imagine that if tissue that's supposed to be within the lining of the womb now appears near the fallopian tube. Let me get that picture back up for you so that you can understand what I'm describing. So imagine if tissue that's supposed to be within the womb lining now starts appearing around it, on top of the ovary or around the tube, covering up the tube. Those are the kind of things that can cause the tube to get blocked. Endometriosis itself is a particularly painful condition. It's associated with pelvic pain around the periods or even outside of the periods. So that in itself is what will give you the pain. Having the tubes blocked itself is not the condition that will cause the pain, although of course you have the endometriosis tissue stuck to the tube or stuck on the tube. So when you have your period, which is generally when that tissue starts to shed and that when the pain tends to happen, you would experience pain, but it's not because the tube is blocked, because of the endometriosis. All right, so those are a couple of conditions. There's also the possibility of hydrosalpinx. Salpinx is another term for tube. And hydro, of course, refers to water. So this is when the tube itself gets swollen, full of fluid, pretty much like that picture that I've been showing you actually, which is, of course, blockage. And so the sperm and the egg cannot travel as they're supposed to. And of course, this can also develop as a result of infections. And sometimes when somebody goes to have their HSG, which is that investigation where they're trying to determine what is causing, whether the tube is blocked or not, then they might come back and say, oh, there's hydrosalpinx, and they're saying that the tube itself is full of fluid, it's swollen, it can't do its job properly. So things like previous surgery, even an infection like appendicitis, for example, where there's been inflammation within the abdomen going into the pelvis, could result in could affect the tube, could cause it to become blocked, and this is when you might experience things like hydrosalpinx. Another cause is an ectopic pregnancy. So somebody who's had a previous ectopic pregnancy and then the tube was treated, perhaps they had surgery to remove the ectopic pregnancy, and when that tube heals, there might be some scarring on the tube, which will then lead to a blockage of the tube. So just a few causes, and the reason I went into that is because I want to establish that these are some of the common conditions that cause a blockage in the fallopian tube. They can be associated with pain, but by the time you recover, or by the time those conditions have happened, it might be months, years down the line before somebody begins to say, oh, fallopian tube. And so especially for something like the first one that I talked about, which was the pelvic inflammatory disease, especially for that one, you may not necessarily be experiencing pain at that time, but the tube itself is blocked. So just to distinguish the fact that the fallopian tube is something that we discover after the blocked fallopian tube is something that we discover after we've done tests. You don't necessarily have a symptom the way fibroids will cause pain or cause heavy bleeding. That's not necessarily what brings you to the doctor. What brings you to the doctor is, oh, we've been trying to have a baby and it's not happening. Then we start to do tests and then they discover a blocked fallopian tube. So I hope to the individual who sent in that question, and thank you so much. If I didn't say that at the beginning, thank you for sending the question, because I have sort of removed people's names just to make sure that we're being just being discreet and protecting people's privacy. So I hope that answers the question, that a person can have a blocked fallopian tube and not realize it. It generally comes to the attention of doctors or to to your specialist when you experience challenges with falling pregnant, and then we go ahead and do tests. But I also wanted to educate you on some of the causes that can lead to a blocked fallopian tube, which themselves can cause pain. Okay, so please have that in the back of your mind. And of course, if you want any clarification on this subject, let me know. So we're going to move on to the next subject. And I wanted to say hello to Space Princess. Thank you so much for joining this live. How are you doing? Where are you watching from? And let me know which of the topics is of interest to you. But let's take a quick break and then we'll come back to question number 2.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like.
Okay, welcome back. So hi. Oh, hello from the UK. Oh, thank you so much for joining. I'm so glad that you're here. Thank you. Welcome, Space Princess. Thank you so much for being part of the stream tonight. So we're going on to question number 2. And this question is looking at the Depo Shot. And thank you so much to the viewer who put in the question. I appreciate that. So I'm going to leave it on here so that we can all have a quick read of the question, and it was in response to one of my videos. So I've left the video title and thumbnail on here. So if you wanted to go and watch the whole video, the original video, then you will find it also under my All About Depo Shot playlist as well. So go and have a look. Anyway, the question says, I prefer the Depo Shot and my body reacts well to it. I've learned that it's a 2-year maximum. My biggest question that I haven't found the answer to: once I stop taking it after 2 years, can I safely get back on Depo, or is it recommended to get it once in your lifetime? So that's the question that we're dealing with today. That's the question. I love this question. I love this question because when I read it, I thought, wow. Okay, so let's start to break it down before I go off on a tangent. Let's start to break it down. So you guys know that I have shared a couple of videos where I talk about Depo Shot side effects. So the Depo Shot, for those who don't know, we're talking about the Depo progesterone. This is what we're dealing with here. I just put a few pictures here, just somebody who's not come across this before. This is what we're dealing with. It's a Depo Shot. It's a progesterone hormone birth control injection, usually taken every 3 months. For some, it's every 8 weeks. Other brands is every 12 weeks into the muscle, and it is a very effective form of birth control. And for many women, it is the answer. They love it for many women, but there are also a big chunk of women who do not agree, who have lots and lots of problems with the Depo Shot. And I like to highlight both, and that's why I have a playlist on the Depo Shot itself on the channel. And if you're considering it, or you have questions around it, then please go and check out that playlist. I think there's so many questions I answered there, but of course, you're always welcome to send in more questions. So the Depo Shot is this hormone injection that you take. And one of the most important things that we should say is about its return to fertility. There can be a delay in return to fertility. It does not, as far as we know, it does not permanently affect fertility. It doesn't stop you. It doesn't make you infertile. Like, that's the best way to say it. It does not make you infertile as far as we know. However, we know that there can be a lengthy return of your fertility when you stop taking it, and it varies from woman to woman. Some people stop the shot and they're able to get pregnant within 3 or 6 months. For some other women, they have to wait a year. Some have to wait more than a year. It's mixed. Okay, so that's one of the most important things to know about the Depo Shot. But this question looks at another very important thing. But let me just address the first thing. Okay, so she says her body reacts to it fine. Okay, that's her good. Now she says, I've learned that it's a 2-year maximum. So first of all, there's no maximum. I really want that to be very clear to anybody who's watching it. There's no limit to the number of times you can have the Depo Shot, as long as it is medically suitable for you. Okay, so you have to pay attention to the fact that I put that proviso in very quickly. There isn't any limit. Okay, so nobody said that, you can only have it once. If you've had it for 2 years, that's it, you're done. No, nobody said that. However, it must still be suitable. So it's not going to put you at any risk of harm if you want to continue taking it after 2 years. That's basically what it means. So you can, if you've had it for 2 years, right, and you want to continue the method, because just like our lady here, you're happy with it, you want to carry on with it, you can do, but we must make sure that nothing's changed in those 2 years that could make you at risk of taking it. But where did those 2-year thing come from? Where did the 2-year thing come from? And what exactly do I mean by, we must make sure that you're okay with it? Every time you're due for your Depo Shot, ideally your doctor should, check in with you, or your nurse or whoever is giving you your injection, your prescription, should check in with you, make sure that there are no issues. Do regular checks. They look at your bleeding pattern, look at your blood pressure, they look at your weight, they look at all manner of different things. If you've stopped smoking or started smoking, or whatever changes have happened. So there would usually be a kind of review, and it might be when you have your 3 months shot, you have that conversation. When you have your 6 months, so when it's 2 years that you've been on this shot, there will definitely be a sit-down conversation. And at that sit-down conversation, one of the things that we'll be talking about is, okay, if you're interested in continuing this, you should know that when you use the shot, it can lead to thinning of your bones. It can reduce the density of your bones, the strength of your bones. And what that means is that it can lead to a higher risk of breaking bones. You just fall down and have an injury, a fracture of your bones. I mean, the reason that happens generally is because of so much progesterone that is contained inside the hormone, and because it reduces estrogen levels. So that means the bones are not, estrogen is an important hormone in our bone strength. So that because you're getting that high amount of progesterone, it reduces the amount of estrogen that is in your system while you're on the hormones, and that increases the risk of thinning bones and therefore fracture. And this is really important for every woman who is on the Depo Shot, but it's especially important for younger women, so women who are sort of in their teens who are on the shot, and then women around perimenopause who still require birth control. Now, that said, when you do stop taking the shot, your bone strength recovers. Does it slowly, but it does recover. It may take quite some time before it gets to I beg your pardon. It might take some time before it gets to the bone strength that it was before you started using the Depo, but it does slowly get back. So it's important. And the reason I say that is so that when you and your doctor are sitting down to work out the plan for the next few months or years regarding this particular birth control, it's all taken into account. So yes, it is possible to restart it, but it's really important that your doctor is part of the plan. They are looking at what potential risks could happen if you're not taking it safely. So if you want to continue after 2 years, one of the things that your doctor will do after having a look at your history, checking, like I said, things like your age, maybe other medication that you're taking that might contribute towards, that might affect your bone health, maybe your kind of lifestyle and activity, your diet, just make sure that you're not at a higher risk of thinning bones, because there are other conditions that can contribute to it. At that point, that 2-year point, they might want to do a bone density scan. That's really important. And for somebody like this lady who wants to continue this method and it's 2 years, she really has to say, like, this is something that they really need to look at. What is the health of my bones? And that question can be answered with a bone density scan. So the scan will tell us, if there's been any loss, how much loss there's been, and that would determine how safe it is and how soon you can actually restart the Depo. Because if there's been sort of like a sort of fairly significant loss, then they might want your bones to recover before you can go back on the Depo. And so they might advise you, take a break. Maybe take a break for 6 months, use some other method, perhaps the pill or perhaps condoms. It's a discussion, it's a conversation. They will let you know, and so you guys can take the decision together. And then other things that you'd also be encouraged, of course, is supplements, calcium supplements, vitamin D, weight-bearing exercises that can help to strengthen the bones. And this is something that you should even do while on the Depo Shot, actually. So yeah, I think that sort of answers the question. The key thing, let's put it back up on the screen so that we all know what we're dealing with here. We're doing question 2. So somebody who loves the Depo Shot, her body reacts to it, but then she's heard this story about a 2-year maximum. So there isn't a 2-year maximum in the sense that, you can only have it once and after 2 years you are done. No, that's not true. The 2-year issue is that at 2 years, your doctor wants to know, what is your bone health like? That's what that 2-year is. And that's the time when they want to do a scan to look at your bone health and advise whether, it is safe to continue or take a break or whatever it is, depending on the scan, as well as other elements of your medical history. For example, if you smoke, if you're on certain medications, like I've mentioned already. So yeah, I think that's the most important thing that you should know with regards to this question. And again, I do thank you so much for asking it. I love the question, and I hope this answers your question. I will, of course, share the stream with the people who asked the question so that to point their attention to it, once we've finished. So yeah, let me just catch up with a few more comments. Hi, LLS, watching from the US. Thank you so much for joining. Good to see you here. And we've got Space Princess says, I'm here for the Depo Shot information. I've been on it for 8 months, getting it lots of night sweats and sweating easily, gaining weight even though I'm eating a normal amount. Goes on to say, plus I'm eating healthy. Has helped me with a lot of medical issues in other areas. Yeah, so like I said, I do have dedicated video looking at what's it called again? Untoward or unexpected side effects from the Depo Shot. And I think it's a good idea to watch that. And again, we're talking about night sweats, so I wouldn't want to blame any one reason for the night sweats? We don't know. I think that if you're having night sweats, they should speak to your doctor about it so they can look at possible causes and not just assume it's a Depo Shot. You may end up at the end of the day that, okay, it might be that this medication is causing that effect, but there's so many other causes of night sweats that we should consider. And that's why I think it's really important that, you have that conversation with your doctor. We haven't looked at, the age, and is there something to do with perimenopause, for example. We haven't looked at, other reasons. Are there other medications that you're taking that may be associated with causing sweating or sweating at nighttime? So while it's possible that the symptoms are because you're using the injection, I take that on board, but I do think the first thing I would want to do is sit down with you, have a total good history of your current situation, look at your past medical history, look at everything else that's going on with you. Perhaps we need to do some tests. Maybe we need to do your blood work to find out if there are any changes there before we conclude that what this symptom that you're experiencing, the sweating, is as a result of the Depo Shot. With regards to weight, I also empathize because many women have complained about experiencing a lot of weight gain on the Depo Shot. Now, I have a lot of affiliations with the Faculty of Sexual and Reproductive Healthcare. It's number one. It's in the United Kingdom. It's the primary source of guidance for sexual and reproductive health, and not only in the United Kingdom, internationally. And we have research that people have looked at studies. They've reviewed different studies looking to answer this question: does the Depo Shot cause women to gain weight? Now, looking at that research tells you that there is no one consensus, because there are some studies who have seen an association between women taking the shot and gaining weight. However, there are also studies that do not see that link at all. And so we cannot say categorically that taking, the way you take paracetamol and a headache goes away, you can see cause and effect. We cannot say that there is a clear cause and effect between the Depo Shot and gaining weight. But there are many women who have this experience, and what we usually say is, right, if you're taking the shot and you find that you're experiencing a lot of weight gain, I think over 5% weight gain in the first 3 months or so, then you might want to have a conversation with your doctor about coming off the shot and going to a different form of birth control. So there's no argument really, because like I said, the studies give you varying two different answers. So what you do, it may be that you need better studies, it may be that you need so many different things to standardize the studies. That's what we have at the moment. But I do appreciate the challenge with that, and of course encourage women who are on the shot to make sure that your diet is healthy, you're exercising, doing everything that you can to minimize the risk of weight gain. So hello Willie Nikki, thank you so much for joining. I don't know where you're watching from. Okay, Swiss Princess, you're welcome. Yes, please do have a conversation, present all the symptoms to your doctor and they will take things from there. Okay, so hello Willie Nikki, I don't know where you're watching from, and I think your question is around, will norethindrone acetate cause cancer or any other side effects by taking it orally? If it's getting into your system, whether it's orally or by injection, the side effects, there might be to different extents, but you will still have similar side effect profile. And the side effect profile will always be listed on the patient information leaflet. So what I mean by that is whether it's been taken orally or whether it's been whichever way it's been being taken. And I would usually recommend a conversation with your specialist, whoever has done your prescription, about cancer risk, especially as it pertains to an individual, because I think we tend to sort of pick up on cancer and then sort of go with a particular narrative, and it's not being the context. We don't get the right context, because for many of these hormonal birth control methods, there are slight increased risk of cancer with them. The risk is a small one compared to the general population or other people who are not taking the method. But then you should also consider, because it depends on what is it that you're looking for. Are you quite keen to avoid an unplanned pregnancy? Have you tried other methods, non-hormonal methods, and they've not worked for you? And what about other things that could increase cancer risk around us, for instance? So there is that conversation, and being overweight can increase the risk of cancer. Using certain kind of other medication can increase the risk of cancer, not just, a hormone like progesterone. So I'm not trying to excuse it, but I'm trying to look at the context. Smoking, alcohol, those are other, apart from being overweight, those are other lifestyle factors that could affect cancer risk. So when your question is around, will this particular drug cause cancer, then all of these hormonal birth control methods, there is a slightly increased risk with one type of cancer or the other. And the conversation, as it pertains to you, has to be in terms of your own personal health, and it needs to be while you're sitting down with your doctor to look at it. Thank you. Oh, you're watching from the United States. Thank you so much for joining. I appreciate your time. And I've got Zaytuna. Oh gosh, I hope I'm not going to mispronounce this name, and I do apologize. Zaytuna Neuro. I'd love to know what Zaytuna means. It sounds like a very interesting name. Anyway, used Depo for 2 months now, almost 3 years, trying to conceive, but it's hard for me. I empathize. I think I have a video that looks at that. Actually, used Depo for a long time and then struggling to conceive. It's not an unusual story. Again, it's something that sitting down with your doctor, whether it's your general practitioner or if they referred you to a fertility specialist, sitting down to look at the whole, all the factors that might be associated with it, because sometimes it might have to do with, if you've been on the Depo for 3 years, how old are you? Are you sort of getting to a point where your egg quality and quantity is not as high as it was 5 years ago? And so it's not impossible, it's just that it's a bit more difficult to get pregnant. It's not impossible. That's not the fault of the Depo. That's because as we grow older, our egg quality and quantity will reduce. That's the natural, that's what happens to all of us women naturally. So it's good to look at that. Are there any other medical conditions going on? And I'm not going to answer those questions here. I'm just saying to you that it's important to have a conversation with your doctor so that they can look at what is specific for you, look at what the issues are specifically for you. Okay, so I would like to go on to the very next question, because like I said at the beginning, we don't want to spend too long. Okay, so Willie's just put in something here. I just had fibroid surgery, and since I'm anemic, the surgeon recommended that I take the norepinephrine acetate to stop my period so that my blood count will increase since I have menorrhagia. I got it, understand. Yeah, I would say, any of those concerns, please have that conversation with your specialist, because we don't want to say, oh, this drug causes cancer and then let's stop taking it, but we haven't put it into context. I think having that balanced decision, if they say to you that, look, there's about a 5% increased risk of cancer, and then they also want to look at in your history, in your family history, is there a history of cancer? Some of the things that might mean that, well, perhaps there is a bigger association with cancer, or that there's a bigger risk with cancer. So have that conversation with your specialist and use that to make the decision. But please, let's not say we're not going to take this particular drug because, we hear that it causes cancer, or that we heard that it doesn't cause cancer. We need to put it into context. Okay. Oh, that's interesting. I did try to have this conversation with the gynae surgeon, but she kept avoiding answering. Wow, that is really interesting. Well, I don't know if you have a generalist. I don't know if you have a GP, a family practitioner. Perhaps you want to have the conversation with them as well. You've just reminded me that we have our email health information service. If you want to use that, I don't know if I can share. I haven't prepared it, because I was just rushing to do this, but let me see if I can put it up. Just because you've come up with this, I'll just share the screen so that people will know about it. And if you wanted to send a question in, because then that gives us the opportunity to be able to ask all these questions to at least have an idea. Okay, so let me share my screen. Take the advertisement away. So this website is askawayhealth.org. This is our website. We share blogs, articles, videos, and all sorts dedicated just to providing health information. Of course, similar to what we do on the YouTube channel, women's health, family health, sex, health education. But if you scroll all the way to the bottom on the homepage, there is the Ask Me a Question section. Click on that, and then you get to the email health service. And you can use that if you want to get responses to questions like this one, if you're sort of struggling with your regular practitioner and you want to sort of get responses to questions like this. Again, it's so much information that we need to be able to say, yes, this is what might happen, or these are the possible contributing factors. Okay, so hi, Michelle Wilson. Good to see you. Thank you so much for joining. Welcome to the stream. We are going to the third question. So I think we've talked a lot about the Depo Shot. We've just finished answering that question. Thank you so much to the viewer. I think I've answered it as best as possible so that you know what to go back and say to your own practitioner. Let us take a little break, and then we will go on to the question number 3.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below.
Okay, welcome back, and thank you for sticking with me through to this point in the stream. Or if you're just joining, welcome. We're looking at 3 questions posed by viewers of the channel, and the first one was on fallopian tube blockage and whether it causes pain, and the second one that we've just finished having a chat about is around the Depo Shot. And then we looked at some questions coming in from the chat from some of my lovely viewers right in the stream. Thank you so much for the questions. I do really appreciate them. Thank you. Right, so I want us to look at the third question for today, and this is the fibroid related one. I almost forgotten where it was. This is one on fibroid. So the question is, as you can see on the screen, let me read it out. And thank you to the viewer that presented this question. It is in reference to fibroid surgery, and it says, how many days in hospital will you spend after surgery? And do you bleed like a C-section? Or do you bleed like after a C-section? I think is what we're trying to say here. Then do you have constipation after surgery? And what do you do? What did you do to help? Okay. Well, I sort of had to put it together that it was in reference to fibroids because it came on the bottom of a fibroids video. And if you're watching, the person who sent in the question, thank you. So let's just take it bit by bit because it's quite broad. And the reason I say it's quite broad is that there are different types of fibroid surgery. So we're going to assume that they're referring to a myomectomy. I think that is a reasonable assumption. And again, this is not specific advice to anybody or to this person because I don't know their medical background. I don't know anything about them apart from this question. But the number of days that you will stay following a myomectomy will first of all depend on the type of myomectomy because, hooray, decades since the myomectomy surgery, I think, first started, we have different versions that have some advantages compared to the standard, open myomectomy. When I say open myomectomy, I mean where the doctor or the surgeon performs a cut like a C-section bikini line cut. So that the abdomen itself and the pelvis, actually more accurately, is opened so that the womb can be seen, and then they cut into the womb, they extract the fibroid. So that's the first type. That is the oldest type that we know. It's extensive surgery. It's also called laparotomy. So if you hear somebody saying a laparotomy, they're talking about a cut into the abdomen. Okay, so this kind of surgery, you're going to need to be under general anesthesia, and this kind of surgery in today's world, okay, if you're in a very well-equipped center, if you're at a center that is, what's the word I'm looking for? It's not very well highly qualified team and doctors and nurses, but you're very well equipped, very high functioning center. Many women will be looking at staying not more than a couple of days, so not more than 2 or 3 days really after the surgery. So because all they're doing is just monitoring to make sure that bleeding has settled, to make sure there's no risk of infection, to make sure that You're passing urine normally, your bowels are working fine, because that is extensive surgery where a lot of movement around your bowels and your bladder, your internal organs would have happened. So they keep you in just for those couple of days, like I said, 2 to 3 days, to work, make sure that everything's fine before you're discharged home. So now let's remember that the question that we're dealing with is, how many days in hospital after surgery? Okay, so with surgery like an open myomectomy, where there is a cut into the abdomen, a wide cut into the abdomen, like a C-section cut, you're looking at 2 to 3 days. Okay, now what other types of myomectomy do we have? We have what we call laparoscopic myomectomy, because if you remember just now, I said laparotomy. Laparotomy is where you have a wide cut into the abdomen is opened, okay? But laparoscopy is where you have smaller cuts and where a special machine or special tool, that's the word, isn't instrument, that's the word, instrument, a special instrument with a camera at the end called a laparoscope is passed into those small cuts that your surgeon has performed on the abdomen. So you don't have an opening of the abdomen, but you have those specialized tools or instruments being passed into the abdomen to visualize the womb, and then they're looking at a display, looking at the movement, the camera attached to the instrument in your pelvis and abdomen are being seen on the screen, and so the doctor is using that to carry out the procedure. And of course, you can imagine that needs a very specialized practitioner, so somebody who's done a lot of training to do it. But when it's done properly, is associated with fewer days stay in hospital, less possibility of bleeding, quicker recovery, back on your feet more quickly than if you had done an open laparotomy. So there's also a robotic myomectomy. Let me add that in. That's sort of like a bit of an advancement on the laparoscopic myomectomy, in which case you have something similar, little cuts or even one small cut into the abdomen. It's not opened up. You have robotic tools that are then inserted through that cut, and then the surgeon is, looking at the monitor, looking at the screen, while directing those robotic tools to find the fibroid tissue, remove the fibroid tissue. Now, it's important to say that different types of fibroids, and this is where I should get my picture up, so give me a second. So fibroids, and I didn't talk about what fibroids are. I mean, I think at this point I have over 100 videos on fibroids on the channel, because I break down different types, causes, and so on. And if it's new to you, please have a look at my fibroids playlist. Fibroids are benign growths of the womb. They come out from the womb muscle. They can grow into the inner body of the womb. That is where the baby will lie. They could sort of sit within the muscle, or they could, from the muscle, push outwards. So they could do all sorts of different things, as you can see in the picture I've got here. So for a robotic or laparoscopic myomectomy, they would usually use that for fibroids like the ones that are sort of within the muscle, like the intramural one that you can see here, or the subserosal one. So that wouldn't usually be recommended for something like the ones that are pushing into the internal part of the womb, or where the womb lining is covering. So it can depend on the type of fibroids that will determine which type of myomectomy that you have. So that's something I think that's important to bear in mind. So with a laparoscopic or robotic myomectomy, so you're looking at maybe an overnight stay in hospital, or maybe a day case, i.e. you get there, get to this theater, get to the operating room in the morning, and you're ready to go by the end of the day or the close of the day. That's how quickly, and that's one of the advantages of this method, even though it's more specialized and potentially more expensive, but you have that reduced downtime, if you like, to recover. Because think about it, with the open laparotomy or open abdominal surgery, there is a lot of handling of your other tissues as your doctors are working on the womb. And so that can affect your recovery time. But in this case, there is minimal handling of your other tissues, and that sort of cuts away the amount of time, potential complications, and the amount of time that you have to be in the hospital. Okay, so we're saying that the stay is shorter. Remember that we're addressing a question on how long you have to stay in the hospital after fibroid surgery. So we're breaking it down to say that it varies. I can't give you just one answer, and that's why I can't give you just one answer. Another type of myomectomy is the one that's called the hysteroscopic myomectomy. So bear with me a second, guys. Sorry about that. So we're talking about a hysteroscopic myomectomy, and this is one where the fibroids are removed, or well, the instrument or the tool that's used to remove the fibroid is introduced through the cervix, through the vagina. So it's not about a cut to open up the womb. It's not about a small cut on the abdomen. Now it's about introducing the hysteroscope, which is the tool. And again, it's got a little camera as well that's passed through the vagina into the cervix. And so this is the one that will target, let's bring up that picture again, that will target those types of fibroids, or like those ones that are like, I don't know if you can see my cursor that's sort of sitting, and there's a fibroid that's jutting into the red, inner womb space there. So that is one that may be used to address that kind of scenario with the fibroid. And so they can use either electricity or a surgical blade to cut out the fibroid until they sort of reduce it and they can clear it out of the womb, after the womb space itself. And again, this is a procedure that, or an operation that can be done as an outpatient procedure, as a day case, where you're able to either go home on the same day, or depending on how it goes, of course, you might be able to go home on the same day or go home the day after. Okay, so we've tackled how long you're in hospital after fibroid surgery, and I focused just on myomectomy. Okay, next the question was, do you bleed like with a C-section after surgery? So I think that's a good point, because after all, you're having an operation to the pelvic organ, you're having an operation to the womb, like you're having during a C-section. But the bleeding is slightly different. It's different, because the procedures are different, even though this is operations on the womb. With the C-section, your job is to open up the womb and remove the baby and, and the placenta. Job's done. And then you stitch the womb itself back up, and then the abdomen. Now, you will have bleeding after a C-section because, pregnancy hormones, the same as if you didn't have a C-section and you delivered vaginally, your pregnancy hormones will influence the kind of bleeding that you have. That's not really the same. That's not what's going on when you have fibroids. Please remember that. So yes, you can have bleeding after fibroid surgery. Yeah, it will happen. And of course, it will depend on the degree of bleeding you had before surgery. Let's not forget that. But it is usually less. It is usually less than with a C-section. So some bleeding is expected, but not as heavy as following a C-section. Of course, individuals vary. Please, let's remember that. But, let's have it in mind that compared to the bleeding loss or the loss of blood that you have after you've had the baby, hormone levels are reducing, you're passing low-K and all that. And this is without any complications, because that's a different matter altogether. What else would you expect after fibroid surgery? You may have cramps, period-like cramps, like you were having a period, like a menstrual period. You might have cramps, and there might be blood clots. I would expect them to be small ones, especially if there's no complication, especially if all the blood vessels that your doctors or your surgeons will encounter while they're operating have been cleanly and properly sealed off as they do. I don't expect any complications. So you'd expect some bleeding, but not a lot. If the bleeding is heavy, if there's very heavy bleeding, I will be concerned about possibility of an infection or possibility of a blood vessel that has not been well closed off, and that's why bleeding is continuing. Those are emergency situations. You must seek urgent medical attention if you have heavy bleeding, flooding, wetting, soiling your underwear, soiling your clothing, passing very large clots. All that suggests heavy bleeding is going on, and that is an emergency condition or emergency situation. And then they asked about constipation after surgery. Let's have a look. I think we're just going through the question and trying to answer them one after the other. How many days? We've done how many days? We've had, do you bleed like a C-section? No, you don't. You bleed, yes, but not as heavy as a C-section vaginal bleeding after the surgery. Then they asked about constipation and what would help the constipation. So especially if you've had an open myomectomy, it's common to be constipated, and I've mentioned that a couple of times, the reason why already. One of them is because the anesthetic that you're given, it's general anesthetic. One of the reasons is that it could affect your bowels. That's the side effect of the drug, or even the painkillers that you're given during surgery and after your surgery. I mean, usually they're opioid painkillers, and one of their side effects is constipation, is one of their side effects. But the other thing as well is you're not going to be moving around after your surgery. You're trying to recover, so you're not going to be sort of jumping around, doing exercises, the things that normally help our bowel movements. So all that will contribute to a sluggish bowel and increase the risk of constipation. So yes, you can expect that as a result, but to reduce its impact and even reduce the risk of its happening, then as soon as you can, make sure you're drinking plenty of fluids, especially water. Make sure that you're having a high fiber diet, like fruits, whole grains, vegetables. Make sure that's incorporated into your meal as you start eating. Really focus on that. The other thing is, when you can, when your doctor has given you the okay, start moving around. So short walks, exercises that don't put any strain on any of your wounds or any of your wounds is really important, so that they're not opening up or causing any other problems. If you need to, if you're struggling, your doctor can prescribe stool softeners or laxatives, so that can help as well. So there are ways to get around this. And just to add on to that, for people who are preparing for fibroid surgery or thinking about it, of course, your hospital team will have a discussion. Please ask if they haven't told you or haven't explained to you what to expect. Please sit down and ask them. Okay, so you might experience or you can expect to experience some pain or discomfort after surgery. That will be covered with of course, during surgery, your anesthetic, but after surgery with your painkillers. But if you're struggling, please ask your nurse or doctor so they can make sure you're on the right amount of painkiller to keep you comfortable. The other thing that you might expect is to be very tired, because of course you've been through, even if it's robotic surgery or like we're saying, hysteroscopic myomectomy, you wouldn't feel exactly the same, right, the first day or week after surgery, even though we say that the return to normal functioning is faster than with an open myomectomy. Make sure you take a lot of rest. Don't just rush back into things. Allow your body to recover. Don't forget there's bloating. Again, we've talked about constipation. I said earlier that there's a bit of, not just a bit actually, there's a lot of handling of your tissues, especially with open myomectomy, where they need to bring out the womb. They might need to move the bladder out of the way, move the bowels out of the way. Not just might, they will need to move tissues out of the way. So that's the handling that happens in an open myomectomy that will cause things like sluggishness and bloating. And that's why they keep people in hospital for a couple of days to make sure that things have come back to normal before they're discharged. Now, of course, infection is a possibility, but again, we emphasize surgical safety. One of the most important things is making sure that the sterile equipment is being used. The people who are carrying out your operations, from the doctors, the nurses, the anesthetists, and the porters, and everybody involved, it is all sterile. You're being handled, your body is being cleaned properly, the wound area is being cleaned properly, instruments and tools are being accounted for, they're being handled in a sterile fashion to reduce the risk of infection. But of course, it could happen, and it does happen after all the best efforts are made. So look out for things like redness or swelling around the wound. If that happens, or it's extremely painful, when really the pain should be reducing day by day, not increasing. If that is happening, then it might suggest the signs of an infection. So those are some of the things that you might expect after fibroid surgery. What else? We talked about bowels. For myomectomy and open myomectomy, where you have or even the other procedures where you have a catheter put in place, a tube put into the urethra, just to rest your bladder during the surgery. It might be important. It is important for the doctors to monitor, make sure that you can urinate normally before you're able to go home. Similar to making sure that your bowels are moving properly and you're able to eat, able to pass gas. All these are things that are important to check before you're able to go home. And sometimes after surgery, there might be mood swings. You've had some time to prepare for the operation, and then it's happened. For some people, it can be overwhelming. It can be, quite a lot to take in. So give yourself space, give yourself time. If you can, if you've got support around you, accept offers of help in whichever way, just to help you ease back into normal life after your procedure. So the key things: make sure that you're resting, make sure you're speaking to your doctors about any questions that you have, getting their patient sheets and advice after surgery. Really important to look at them, help you to plan. I've also got a guide on which I will leave the link in the description box on recovering after surgery. I've just remembered actually that I have a guide when it comes to the different fibroids treatments. It is included in that guide. So those are the sort of the things to think about as you recover: resting properly, eating well, making sure that you're checking with your doctor to find out if there are any issues that need to be addressed. So I think we've I think we really looked at this question. I think we really dealt with it. So I hope that it has answered the query from the individual. Okay. Let me look at a few more comments. I wasn't ignoring you. I apologize. I wanted to just finish the topic. So let me look at a few more comments here. So Willie says, thank you. You're very much welcome, Willie. Thank you so much for being part of the stream. And then there's a message from Michelle, which I don't think, it doesn't look like it's finished. They cannot do the operation because I've had 2 strokes. So, I think that sounds, what I was just saying about how it can be overwhelming, because we think it's just the physical body, but, there's a lot of strain that goes into this. And Michelle, I'm so, sorry, I don't know exactly what the circumstance is, but I do hope that your doctors will explain as much as possible what the issues are around your history, because if you've had strokes in the past, perhaps they're concerned about anesthesia, perhaps they're concerned, I don't know what your medical background. There could be so many different reasons why the anesthetist and the surgeons may feel that the risks are bigger than the benefits. And I think if you're still trying to puzzle it out, not sure, please talk to them again. Again, I do have my email health information service if you want to use that, because that gives us the opportunity to sort of get to know things a lot better, and then maybe just shed some light, or even suggest a few more questions that you can go back to sit down with your practitioners and hopefully get an answer that will help you understand, what they are doing or what they mean. And then we've got another question from LL. Is there anything a patient should do to prepare for fibroid surgery? Oh, that's a really good question. Thank you for asking that. I think that's a really good question. Oh, let me leave it on here. I think that's a really good question. The most important thing is about the recovery, because what is in your control when you've decided to go for surgery. You'd have done your research and you've picked the doctor or the surgeon who's going to work with you. When I mean that you've picked them, we all have different types of healthcare systems. Some people will go privately, some people go via the NHS, and some people might feel, well, they don't have any control over who does their surgery. To some extent you do. If you doing the assessment and doing your consultations before surgery feel as if you're not really happy with your surgeon, you can, have a conversation with your generalist or whichever hospital management about changing them, so there is some control. But by the time you've agreed that you're going to go in for an operation, you've got your date and you're working towards that, you're looking at what are the things in your control. These are things that have to do with your recovery, because really you're not really going to do anything apart from just show up and the doctors and the clinical team are going to do the operation. Really what you want to do is prepare, just look into your recovery. And again, I'll refer you to my guide, which you can download from my the trackers and guides I have. It's called the treatment options for different for fibroids treatment options. And one of the things I do address is what you can and should do, and it goes into quite a lot of detail. So things like work, things like family, things like pets, and getting all that sorted out well ahead of time, so that while you're recovering, you're not worrying unnecessarily. And then it looks at things like your diet and trying to get into a pattern of eating very healthily, trying to cut down on processed foods, because just like we've been talking about constipation now, processed foods and starch, excess carbohydrates can increase the risk of constipation. They haven't got a lot of fiber. So you want to get into the habit of making sure you're drinking plenty of fluids, making sure you're taking supplements that will help your tissues to recover quickly, taking protein, plenty of protein, which would help your tissues to recover quickly as well. If you've got several weeks to go before your surgery, you've got your date a few months ahead. And if you're able to, of course, discuss that with your doctor as well. You might want to do some exercise to help lose weight and just get generally, so that you feel generally healthy and able to bounce back quick after surgery. And yeah, so sort of having those kind of plans, conversations with your doctor, I think it's really important to say this question that you've just asked about, what you should do to prepare. A lot of it is finding out, do as much reading as you can, what to expect, what medicines are they going to use for you, what kind of painkillers. This is having conversation with your clinical team. What kind of painkillers would you expect? Are you going to be on any do you need to be on any blood thinning medication, for example, depending on the type of surgery you're going to have? Is that necessary or not? These are the kind of questions that your doctor will answer for you. But I think the broad group has to do with preparing your home for your recovery, making sure that everything is easy, your meals, helping to get your meals. Remember, you can't exercise and you can't move around as much as you did before surgery because you don't want to put any strain on your wound. So thinking ahead about how that's going to be handled, who is going to be able to help with that, or who you can, sort of call to provide some support, handle food and shopping and things like that for you. Those are the useful, practical things, I think, that you should be considering as you get yourself ready for surgery. So I hope that's covered. I think there are a few more things, and I know I covered a lot more in that guide, and it will be linked in the description box for this video. Once I've sort of settled after we've finished, I'll put the links there, because I think we've covered it to some extent. I've mentioned it twice now in the video, so I will put the link just in case somebody's watching the replay and is interested. But thank you so much. I think that's a really great question. Well, guys, thank you so much. This has been an interesting evening. I'm just going to be rounding up. I've got one late question coming in. So this is Miracle. Hi, Miracle. How are you? Thank you so much for watching. Where are you watching from? And your question is, you've been on the Depo for 9 months now and you want to stop it because you want a baby now. How can you go about it? Okay. So the good thing about the Depo is that, you don't go for the next injection. That's it. You just don't go for the next planned injection. And that's it. You're off the Depo. I usually say to people when they're going on the Depo and they're planning that, oh, in the next year or two, I'm going to start my family. I usually say, try to remember that you want to come off the Depo a good few months before you want to start trying for a baby. Because like I said at the beginning, some women, not everyone, but some women will experience a delay in the return to their fertility. And it's not everyone, but it's good to know that it's possible. And one of the ways I recommend women to handle that delay is, if you know that it's next January that you guys want to start trying for a baby, then you shouldn't be taking your next Depo shot at this time. In fact, you probably shouldn't have taken the one 3 months earlier. I would recommend. So you might want to switch to the mini pill, or switch to another method. And what you're doing is just giving your body time for the Depo shot, the Depo progesterone to get out of your system. And then not only that, for your hormone levels to begin to return back to normal. Those are the things that can take some time, and it differs from one woman to another. So how do I want to put this now? I mean, it's interesting because you said you want to stop it because you want a baby now. Just to put it in context, if you had the implant, for example, the implant is the birth control that goes under the skin. If you had that and took it off today, and I would be worried about you if you didn't have any contraception in the next month. Now, I'm not saying I wouldn't be worried if you didn't have any contraception for the Depo shot. I'm just saying that you could pretty much within a month of taking the implant fall pregnant. That's how quickly your fertility can return. With Depo shot, many women find that the delay is a lot longer. So they may, the fact that you've stopped taking it, I mean, there's some women who could fall pregnant within a month or two after stopping the shot. That's why I said it's such a variable, it varies from one woman to another. But the return to fertility is a lot quicker with the other methods. Now, that's not to make you sad. It's not to make you unhappy. You've got information. So fine, don't go for the next shot. That's literally all you need to do. Okay. Then get your mindset ready for, having a baby. Do all the things that you should be doing. Make sure that you're healthy. Make sure that you're having regular meals, having regular exercise. Make sure that you're not stressed about the fact that you want to start having a baby. Your body will come back. Your hormones will come back to what they're supposed to do. They've only been temporarily sleeping. So please don't panic about it. Please don't stress about it. It will happen. And you just need to calm down. Start taking things like folic acid. Go and sit down with your doctor, get a checkup, make sure that there's everything that's fine, especially if you have any other medical condition or you're taking any other medicines. Let them know, right, we're thinking of starting a family. What are the things that we should know? They'll give you different bits and pieces of advice, but please don't let the fact that you're on the Depo shot scare you. There's no need for that. I think you can just prepare ahead and just be aware. If you're thinking about starting your family soon, then you need to be coming off the shot. If you're still in contraception short term, then using condoms or using other methods, that's fine. And then when you get to the time that, okay, you're ready, then, just stop those other methods. So, guys, I hope that's helped, Miracle. I hope that's, thank you for your question. I hope that's been helpful. LL, thank you so much. I appreciate you. Thank you so much. I hope you guys will join me again soon. I'm going to round things off here, but I've had really great comments and questions tonight. I thank each and every one of you for being part of the stream and for making it really rich by your questions and contributions. That's been so amazing. To those watching on replay, guys, I hope you find this helpful. Please share your questions. Like you can see, I do respond to comments and questions. I get quite a lot, and sometimes I can't respond to all of them. But when I see a few that maybe lots of people are asking, or it looks like, oh, this is quite different, and I didn't realize that this was a problem that somebody was worried about, then I could bring it to a video. So yeah, please feel free to put your comments in your questions in the comment section. Now, I have the email health information service, just in case you didn't hear me talk about it earlier. So if you do want to meet me one-on-one and really have a conversation, or there's a digital concierge service where we could have a video call and we can do this one-on-one, look at the issues, look at how to address them, provide just some general guidance that's more tailored towards you. I'd be happy to do that. Go to my website, askawayhealth.org. All right, guys, Sunday evening, start of a new week. I wish you all the very best. I hope you have a really great week. And whatever you're doing, please be safe, be healthy, and don't forget to check out videos that will be coming out later on in the week. We've got one on antimicrobial resistance, really important topic. So please make sure you check that video out when I publish it, I think on Thursday afternoon. Keep an eye on the community posts and polls. We get lots of engagement, lots of interesting comments and responses to the questions. And yeah, love to hear back from you guys. Anyway, I'm going to let you get I'm going to get some supper and then get some rest. And I've still got another meeting tonight, which is why I need to rush off. But guys, it's been so great being with you tonight. I'll see you again soon. Bye-bye.